The tragedy involving 3 children in Torrance is once again bringing attention to the topic of mental health.
CBS 2's Lisa Sigell is here now with today's Health Watch. Lisa.
Hi, you guys. Hello, everyone. You know, it is the most common complication of pregnancy, postpartum depression. Yesterday's tragic slaying of 3 young children near Torrance has some doctors talking about mental health and motherhood. The birth of a child, we expect it to be the most glorious time in a new mom's life. But within a few days, a different reality often sets in.
Tearfulness, gentle mood swings, irritability, anxiety. This is what we call the baby blues.
Dr. Diana Barnes is a psychologist who specializes in postpartum issues. This empty Sherman Oaks therapy room, often filled with new moms sharing their stress.
I mean, where else in life do you know where you go into a situation as one person and come out as 2?
Dr. Barnes says normal baby blues dissipates within a month. Sadness that lasts longer could be postpartum depression.
The most common way in which we see it present is with overwhelming anxiety, where women feel as though they can't cope, they're very overwhelmed, they may feel frightened about being left alone with a baby.
Up to 1 million new moms deal with postpartum depression every year. In some women, a far more severe illness takes hold, postpartum psychosis.
If a woman is in the throes of a psychotic episode, she may be hearing voices. Sometimes these voices are actually commanding. The difficulty and the challenge with postpartum psychosis is that women themselves may not know what is happening to them because postpartum psychosis actually implies a break with reality.
Dr. Barnes says when mental illness is severe, a mom may not be able to ask for help on her own. So those around her should try to step in. Her message to all moms who are suffering: there's hope.
While postpartum depression is the most common complication of pregnancy, we know how to treat it. And so if you get help right away, you can get back to the business of being a mom.
A personal or family history of mental illness increases the risk of postpartum depression and psychosis. Another risk factor, having babies one right after the other. But we said it in the package and we will say it again. There is help, there is hope.
All right.